Hello, gang. I wanted to both show you and talk to you about a tool that we'll be using during our lab time, specifically when we are going through different simulations. This tool is called the Lassiter Clinical Judgment Rubric, and it is in references different components of clinical judgment. And you can see on the left there are major headings: noticing, interpreting, and then on the second page you'll see responding and reflecting. So this tool is really helpful in kind of thinking about how people are doing in terms of this very complex set of skills that nurses need when they are working with patients. So in the noticing section, you will see that certainly a nurse needs to be very observant and use their good assessment skills in understanding what's going on. They also need to be able to recognize what's normal and what's not. As well as then, based on that information, seeking out additional ways to, find information that is relevant to the patient. In the second section, you have different abilities related to what are you going to do with this information that you've gathered. You need to somehow prioritize. We talk a lot about that in nursing. You need to also be able to make sense of the information that you've gathered. If you just don't have any knowledge about this particular data, then it won't make sense to you. So that's also a very important aspect of clinical judgment. Once you have done these things, then you also need to kind of respond appropriately. That includes sort of looking at how your demeanor is. Are you calm? Are you confident in your manner? That's very important to patients. You need to be able to communicate clearly to not only the patient, but to other members of the health team. Your intervention needs to be well planned. It needs to be also flexible depending on what else is going on with the patient. And ultimately, you also need to be skillful in whatever intervention it is that's needed. Finally, there needs to be the ability as a nurse to reflect on how you did, not only on how what you did impacted the patient, but how a kind of some self-awareness there as far as how you did with respect to your clinical judgment. And then you also need to commit to improving your abilities related to clinical judgment. So this is just a quick look at this tool. We will use it, as I said, during our simulations, during lab time, and so I want you to become familiar with it. And this kind of lays out the different levels of skill that are required for each different aspect of the clinical judgment. Thank you.